Hey everyone, my name is Sonia Gordillo. I'm one of the pre-health advisors in the College of Arts and Sciences Advising located in Tykeson Hall here at the University of Oregon. And today we're going to do an overview of pre-nursing. So, agenda includes looking over the different degree routes, identifying which path is going to be the right path for you, talking about the different, and then discussing steps. But before we dive into all of those variables, let's talk about acronyms. So the first acronym we have listed here is CNA. So that's short for Certified Nursing Assistant. And these typically work under the supervision of a registered nurse. To become a CNA, it's typically offered through community colleges, and it's typically a one-term program. Nursing programs don't require CNA certification in order to matriculate, at least most do not. There is one program that I'm aware of that do require CNA certification, and that's Bushnell here in Eugene. So that's why I say most programs do not, but there could be some that do. Either way, it's a really great way for you to get some experience in a nursing related field before deciding on whether or not you want to pursue nursing. Another option is LPN or LVN. So this is licensed practical nurse or licensed vocational nurse. Those go hand in hand. These also work under the supervision of a registered nurse with a little bit more higher pay than a CNA. LPN, LVN programs are also offered through the community college. And then they are typically about 1 year of a program. Keep in mind that some of these programs are offered through for-profit organizations, and there are even some local companies that might hire you as a CNA and pay for your certification along the way. So you have a few different options. If you're interested in this, feel free to schedule an appointment with us so we can talk about your options for pursuing this. All right, next we have nursing degree options. So ASN, BSN, Associates of Science in Nursing. These are offered through community college. And then we have Bachelor of Science in Nursing. So these are 4-year bachelor's degrees. And either one of these lead you to becoming a registered nurse. So the curriculum is going to prepare you for that NCLEX exam, and the passing of that exam allows you to practice as a registered nurse. A couple more options here would be MSN and DNP, so Masters of Science in Nursing and Doctors of Nurse Practice. So for the DNP, this leads you to become a nurse practitioner. And in order to be eligible to apply to nurse practitioner programs, you do need at minimum a BSN degree. So there's a little question mark next to the MSN. So many of these could lead towards nurse practitioner, but many also don't. So you do need to be careful about that as you're exploring MSN programs, okay? So take a look at their curriculum, make sure it's going to lead you to nurse practitioner if that's what you're looking for. But there are also other programs that are entry level MSN programs, Masters of Science in Nursing. And what that means is that by completing that program, it's going to set you up to take the NCLEX exam and become a registered nurse. So this is sort of a third option to become a registered nurse. So if you're looking into nurse practitioner, most commonly is that you're going to pursue a doctoral level nursing degree, but there might be some still at the master level. So just keep your eyes out for that. Okay, so here are those 4 options laid out: ASN, BSN, ABSN, and then direct entry MSN and DNP. Okay, so as I mentioned, ASN is offered through the community college. These are 2-year programs. That's not including the amount of time you need to complete the prerequisites. That's usually about 1 to 2 years of prereqs and then 2 years of the actual program. BSN is a 4-year program because we're completing a bachelor's degree of science and nursing. So 2 years of prerequisites plus your general core education requirements you need for your bachelor's degree, plus 2 years of the actual nursing program. Next, we have accelerated BSN. So if you already have your first bachelor's in any major, you're eligible to pursue an accelerated Bachelor of Science in nursing. So these are typically 12-month to 18-month programs in order to become a registered nurse. So for example, Bushnell next door, they have an accelerated BSN program. We have many students that pursue like sociology, anthropology, family and human services majors, on top of pre-nursing requirements, and then they'll go off and apply to their accelerated nursing degree. So that could be an option if you're interested in that. We also have a lot of students do a STEM major here at U of O with the pre-nursing requirements, graduate with their human physiology degree or multidisciplinary science, and then apply to an accelerated nursing program. So you're essentially getting a second bachelor's, okay? Then we have direct entry MSN, and then DNP programs. So there are versions of nurse practitioner programs that sort of combine the ABSN with the nurse practitioner curriculum all in one. So many folks kind of start off as becoming a registered nurse. So they'll complete their ASN or BSN degree, work in the field for some time, and then go back to school to pursue nurse practitioner. Now, this fourth option here is direct entry, which means that you're going to do the accelerated BSN, take the NCLEX, pass, become a registered nurse, but instead of working out in the field, you're going to continue the curriculum into nurse practitioner curriculum. Okay, so you're just going to go all the way through direct entry. So if that's of interest, do take a look at some programs out there. I know OHSU does have some direct entry options. Okay, Acne. So let's say you do want to pursue nurse practitioner down the line, but maybe you started off with the ASN option. So if you're wanting to do ASN, so Lane Community College is a really great program. It's community college, so it's going to be a little bit more affordable than completing a nursing degree at a bachelor's institution. So this is a really great option. And so we have a lot of students that will do 2 years of their ASN degree and then go off and then pursue ACNE, which is a 1-year distance education through Oregon Health and Science University. And then that 1 year, you're completing the curriculum to get your BSN. So this is just sort of a bridge to get that BSN so that in the long term, you can apply to nurse practitioner programs if that's your goal. All right, so transitioning to talk about prerequisites you need for admission. So common requirements include that 1 year of anatomy and physiology. Typically, you'll need 1/4 of statistics, a nutrition course, a lifespan development course or developmental psychology, 1/4 of microbiology with lab, and then 2/4 of writing. Oregon nursing programs don't require a public speaking course, but many outside of Oregon do. So if you're thinking about applying to nursing programs outside of Oregon, we do recommend that you pursue taking a public speaking course. So these prerequisites are required to be graded. Pass, no pass is not accepted, though. If you are concerned about potentially not passing the course or you're borderline, be sure you're connecting with academic advisors to talk about pass, no pass so that we can make sure that you're protecting your GPA and then retaking it when you feel ready to take that. With that being said, a lot of these programs do require a B or better on these prerequisites, okay? Other health graduate pathways like physical therapy and medicine require a C or better on the prerequisites. Many nursing programs want a B or better, okay? So the expectations on these prerequisites are a little bit higher. Okay, I'm not saying that to say that all nursing programs require a B or better, but many do, okay? So with that, it will be helpful for you to be exploring some programs to make sure that you're checking the prerequisites, making sure that you have all of those common prerequisites, plus maybe they require an additional course that isn't on the common requirements list. And you're also wanting to check the minimum grade requirement and keeping yourself organized, okay? So it's never too early to start exploring nursing programs that you'd want to apply to. We actually recommend that kind of from the get-go. Okay, so prerequisites that vary considerably could be like a cell biology course. Maybe they want a chemistry with a lab. or an ethics or critical thinking course, and sometimes maybe a sociology or anthropology. So these are kind of like those sometimes required that may or may not need to be added to your graduation plan. So that's why we recommend you starting to develop your list of schools early. All right, so here's a sample 3-year plan. So as you can see in that 3rd year, you'll see that year-long sequence of anatomy and physiology. So hyphy 321, 22, 3, 4, and 5 completes the year-long sequence. We have English 200, that is our public speaking course here at U of O. Then we have microbiology lecture and lab that's offered every fall and spring. We have nutrition, hyphy 105, statistics, that's stats 243, bio 211, that's the cell biology, and then the developmental psychology course. Okay, so I put all of these in kind of highlighted because I wanted you to see that those are the common requirements, but we also have other science courses listed in here. And the reason for that is because there are prerequisites for the prerequisites. Okay, let's dive into that a little bit more. So when you are preparing to take anatomy and physiology at the University of Oregon, the prerequisite for this sequence is a year of general chemistry, so Chem 221, 22, and 23. You need 2 quarters of bio, so bio 211 and 212, and then the 2 human physiology lower divisions, hyphy 211, that's medical terminology, and 212, that's called scientific investigations in physiology. So all of these will prepare you to take U of O's anatomy and physiology sequence. It's a 25 credit upper division sequence. It involves a human cadaver lab. It's pretty fast paced and intensive, but students tend to really love the curriculum of this sequence. So it's pretty unique to the University of Oregon. The comparison to this is taking it through the community college, in which case the prerequisite to take anatomy and phys through the community college is 1 quarter of biology. So bio 112. And then from there, you'll take the anatomy and physiology sequence. So bio 320, 231, 232, and 233. So it's combined, it's anatomy and physiology combined for a total of 12 credits, comparison to 25 credits at U of O. And then once you finish that sequence, then you can take their microbiology. And in order to take U of O's microbio, you're looking at taking bio 211, 212, and 214, and then you can take microbio. So you're adding another bio lower division to take U of O's bio upper division, microbio upper division, I mean. Okay. So in addition to that, in order to take U of O's developmental psychology, you need to take Psych 202 first. It says Mind and Society. I think it's retitled as Intro to Psychology Part 2. You don't have to take Intro to Psychology Part 1 in order to do the Part 2, so you can just do Part 2 and then developmental psychology. So as you can see, the U of O pathway is significantly longer to complete the prerequisites because it's more science intensive. Okay, you're doing about 2 years of science prerequisites before you can tap into anatomy and phys. You're doing about 1 year of biology lower division before you can take that upper division microbio. Okay, in order to start the chemistry, you do need to be at minimum in what is it, pre-calculus. So math 112 is the co-requisite or prerequisite for chemistry 221. Okay, so if you are starting with math 101 or math 111, you're doing that first before you can jump into the chemistry. So that's why our pathway is 3 years to complete the nursing prerequisites versus completing it through the community college. It's going to take about 2 years to do that. So here's a sample plan. If you were to do the prerequisites through the community college, you could do bio 112 in the fall, then do the anatomy and physiology sequence for 3 terms, microbio, You could choose to do nutrition through the community college. They typically offer that online. Same with that lifespan development course. So about a little over 2 years to complete all of the prerequisites through the community college. That's not including statistics that I put in bold here. Okay. If you do this, you can choose to take those prerequisites either in your freshman, sophomore year or junior, senior year. If you're wanting to transfer out of U of O and into a BSN program at another institution, you'll likely want to do this your freshman, sophomore year. And as you can see, you're looking at one course a term at the community college. So many students do this and are able to manage to do their 12 credits at U of O, so they have the full-time status for financial aid and scholarships that they need, and then they'll do that one class sort of on the side, pay for it out of pocket. For the community college, they might need to travel to the campus in person, but it's about 10 minutes away from campus. About 10 minutes away on the bus, it drops you off right in front of the campus. So it's a really great option if you're wanting to do this. Just keep in mind that you'll want to pursue a non-STEM major if you're doing the prerequisites through the community college. Okay, so majors in sociology, psychology, family and human services, business, anthropology, those tend to be the 5 most common ones we see for pre-nursing students that are not pursuing STEM majors. Though you could be any major that you'd like, just add in those pre-nursing requirements on top of that plan. If you wanted to do the prerequisites through the University of Oregon, then the most common majors for that is human physiology and multidisciplinary science. Okay. So a little bit more details about dual enrollment. So dual enrollment, like officially dual enrolling, would allow your financial aid to be dispersed at both the University of Oregon and Lane Community College. Okay, so it's a form that you fill out and submit to the financial aid office, and that allows your financial aid to be dispersed at both institutions. Now, it may or may not make sense for you to fill this out. We recommend that you come into advising to discuss this a little bit more. Something to keep in mind is that if you have between 0 to 90 credits, your financial aid home is going to move to the community college, which means that they're going to base your financial need off of the cost of tuition of the community college. Versus if you have more than 90 credits, your financial aid home is going to remain at the University of Oregon. Financial aid will base your tuition need off of the cost of tuition of the university. So if you need to fill out the dual enrollment form for financial reasons, might make sense for you to wait until you hit that 90 credit mark to start completing the prerequisites at the community college. But every student situation looks different. So when you're starting to think about this additional nuance in this process, make sure you're connecting with us to make that informed decision. Okay, so additional considerations. So in deciding whether you want to do ABSN, BSN, ASN, so you want to think about timeline first and foremost. So if you're wanting to work in the field as soon as possible, then ASN or BSN could be your quickest option. For ASN, you're looking at 1 to 2 years of prerequisites, the program, and then working in the field. Similarly, for that BSN, you're doing about 2 years of prerequisites, 2 years of the program, a total of 4 years. So roughly between those two options, you're looking at 3 to 4 years in total. ABSN is also a really good option, but you're looking at completing your bachelor's degree first, so 4 years of your first bachelor's and then 12 to 18 months of that accelerated nursing program. So you're looking at a total of about 5 to 5.5 years. Okay. So that's something to keep in mind when you're comparing those options. Another thing to keep in mind is cost. So if you are wanting to pursue ABSN, just keep in mind that it's your second bachelor's degree, your bachelor's of science in nursing. It's accelerated. With that, you will not be eligible for grants straight off the bat for financial aid because it's your second bachelor's degree. So keep that in mind as you're exploring that option. I think that's why sometimes students tend to lean towards ASN or BSN, which means transferring out of the U of O and applying to those programs. But we do have a number of students that for other reasons, it makes sense to stay at the University of Oregon for a full bachelor's degree and then pursue ABSN. Some things that motivate students is because they're already on scholarship through the university. Maybe they've already developed a community and want to remain here, or they're involved in sports. And then, yeah, those tend to be some of the main reasons there. Oh, and that's what I was going to say. The last reason could be like some BSN programs could be impacted in terms of applicants. And so it makes sense for you to pursue ABSN because it gives you a higher chance of matriculation. So that could be another reason. Now, all that aside, competitiveness is really important to think about when making an informed decision. So we're talking about whether or not you should pursue the pre-nursing track through U of O. That's the more science intensive route. Or the pre-nursing track through U of O / community college, do the nursing prerequisites through the community college. And that's a less science intensive track, as you can see. Which one should you pursue? Well, it depends on how you want to utilize your time at the university, whether it's science courses and the opportunities available through the science courses. Maybe you're really interested in the curriculum. Maybe you really want to do the human cadaver lab and being teacher assistants for these departments. Those are really great reasons. Maybe you really love science. Another really great reason to pursue that science track. We have a lot of students that do the less science intensive option because maybe they don't love math and it just makes sense for them to do that option. Maybe they love the flexibility of doing a non-STEM major like psychology with potentially adding a minor to that, giving them a different angle of their education to add on to their nursing career. Okay, so there's some pros and cons here, but overall keep in mind that when it comes to applying to nursing school, it's going to be a very point-based admissions process. So the higher the grade, the higher the outcome, the higher the possibility of getting admitted into a nursing degree. You need at minimum a 3.0 cumulative GPA to be eligible to apply to most nursing programs. Typically a 3.0 science or prerequisite GPA. And like I said, typically like a B or better in those science prerequisites. Okay, so it's a pretty competitive process. And so that's something to really keep in mind if you're kind of in between doing the science intensive route through U of O or the less science intensive route through the community college. We want to make sure that whichever option you're deciding on, we're going to set you up for success. So if you do the science intensive route, great. I think that's awesome. But familiarize yourself with tutoring support on campus, build a community so that you're connected to peers in your class that are also taking the same courses and can study together, go to office hours, utilize all of the services available to you. Because that's going to be really important, making sure that you have a competitive application at the end of your degree here. Okay. And then if you're choosing the community college route, also a really great option. You get that flexibility in your graduation plan. Make sure you're connecting with advising services at the community college if you're needing support in those anatomy and physiology microbiome courses, going to office hours, tutoring support through that college as well. And of course, we can help navigate that with you if you have any questions. So those are just some things to think about when it comes to competitiveness and deciding which one is going to be the right option for you. Okay, so as I mentioned, you do want to be exploring some programs early on. So if you're reading their website in terms of their prerequisites, they might list it in semester or they might want a specific credit amount. So make sure that you're going back to this page to do that credit conversion. All right, so next steps would be to explore nursing programs, getting organized with admissions requirements, and creating an academic plan. So 3 very key things there. And like I said, we're happy to help you with that process. So please be sure to schedule an appointment with us so that we can finalize your plan. And if you have any questions after this presentation, feel free to email us at prehealthadvising@uoregon.edu. All right, thank you so much.